Hi, welcome to Dystonia Me. My name is Jordan. I have generalized dystonia. Dystonia is categorized as a involuntary movement disorder that manifests as sporadic and twisting movements. I've had generalized dystonia since I was around 9 or 10 years old. It first started as a focal hand dystonia, progressed to my feet supinating, and moved into my speech. So with dystonic symptoms, tremors and posturing can happen all over the body, but in my case it started with my hands, then progressed to other regions including my feet, as you can tell in my speech. When I turn off the therapy, you will hear me say that my tongue fills my mouth. Apart from the obvious lip droop, before DBS my tongue would press outward on sides of my mouth against my teeth, making it very difficult for me to speak. I've had dystonia since I was around 9 years old, but it was only recently that my symptoms worsened to a point where I felt that I needed help. My dystonic symptoms had progressed at university while studying neuroscience, so that I was unable to write more than a sentence or two a week without excruciating forearm pain. This is why I chose to go ahead with the DBS surgery. DBS is short for deep brain stimulation. Today I'm going to show you how that works. This is my Medtronic Percept controller and Bluetooth device. This is the Bluetooth connectivity device for my controller. And this is the controller I have. It's a simple Samsung smartphone that has my left and right side milliamperage. Now I want to show you how the DBS affects or improves my speech. During surgery, I would say the phrase Sunday, Monday, Tuesday. You can hear how well I can speak that. Now I'm going to turn my DBS stimulator off. Turn off therapy. Okay, it's communicating. You can see here, it says communicating. Okay, there, it turned off. Okay, now I'll wait for a bit and still talk to you about how my symptoms are coming back and how it's feeling. So I feel a bit more of a pull in my right side of my face, near my mouth, and I am noticing that my forearms are starting to shake more. I'll try the speech technique they had me do during surgery now. Sunday, Monday, Tuesday. I am feeling more tension in my neck. I think I have most of my symptoms back that I had before. I'm noticing some difficulty swallowing. My speech impediment doesn't seem that bad right now, but it's hard to tell. It doesn't quite feel like my tongue is filling my mouth as it did before. Okay, I'll try that one more time to see if it came on worse now. Sunday, Monday, Tuesday. Okay. Alright, you can stop it. Now I'm going to show you how my hands function with the DBS and without the DBS. You can see on my left hand there's still a little bit shaking because I turned off the DBS stimulation, but my right hand came back pretty quickly. So I'll write a few sentences. Hi, my name is Jordan. I have dystonia. So my handwriting is not that legible, but quite a bit more than when I turn it off. So I will turn off the therapy now and show you how my hands progress. First I'll do this without the writing portion. And you can see how my hands begin to shake quite rapidly. Okay, now I'll try to write the same few sentences. And now you can see that my grip has changed. There's not much I can do about that. And that's how much the DBS improves my function for writing. I'll turn it back on. And you'll be able to see it kick in almost right away. This is uncommon for dystonia patients. Usually can take up to a week or a few weeks, depending on the patient. Mine's almost immediate relief, as you can hear from my voice, and my hands now are fairly steady. As you can see, the writing is quite a bit shakier for me without the therapy. But I did not want to write until it hurt me, so I stopped at a couple of sentences. The DBS has been life-changing. As with any major surgery, it took a commitment, as well as a long recovery, a lot of programming sessions, but I'm glad that I chose this.